I'll just say a couple of words of welcome, actually, before our Dean, Professor Lai, gives a welcoming speech. I'm Alistair Cole, a professor and head of Department of Government and International Studies, and we've been organising this conference, in particular with Professor Baker and Professor Owen, for quite a long time now. It's finally come to fruition. I'm delighted to see so many of you here, and of course there are many more of you on Zoom. But without further ado, this exciting conference on transnational and transdisciplinary lessons from the COVID-19 pandemic, I'm going to hand over to Professor Lai for the welcoming speech.
Thank you very much, Professor Cole. Good morning, everyone. Good morning to those who have been here today, as well as those who are online. The Faculty of Social Sciences of the Hong Kong Baptist University celebrates its 50th anniversary this year. This two-day international conference on transnational and transdisciplinary lessons from the COVID-19 pandemic is one of our flagship conference and event this year. This important conference is organized by our Department of Government and International Studies, Department of Sport, Physical Education and Health, and David C. Institute for East-West Studies, with the generous support and sponsorship from the Hong Hin Chiu Charitable Foundation, Hong Hin Chiu 慈善基金. In the past 1.5 years, the world has been struggling to cope with the COVID-19 pandemic. Many issues and questions concerning COVID-19 and its impact are critical and central to the medical and social sciences. From an international relations perspective, COVID-19 gets to the heart of what comprises a common good. From a public policy perspective, COVID-19 is the wicked policy problem par excellence, requiring interagency collaboration. From a comparative health policy perspective, COVID-19 provides a vast living data set to engage in multi-level comparisons and real-time experiments. In the medical research field, the advancements in medical science in a living lab that faces the challenge of 164 million people infected and 3.4 million lives lost. Responding to existential dilemmas, the COVID-19 pandemic calls for a major transdisciplinary research effort that necessarily combines several levels of empirical analysis and methodological goals, tools, and bridges distinct academic and scientific traditions. Day one of the conference will begin with the presentations of interdisciplinary COVID-19 research at HKBU, delivered by Professor Guo Yike, the Vice President of Research of our university. The conference organizers have also invited communications which addressed one or more of the following cutting-edge issues at transdisciplinary and/or transnational intersection on the pandemic, including medical and psychological perspectives, comparative perspectives, economic and financial consequences, trust, transparency issues, risk and resilience as coping strategies, crisis management and governance, global perspectives of governance and societies in the pandemic, environmental health, public opinion and support for opposition to vaccines, social media communication strategies, big data, smart apps, and the pandemic. And of course, how's the world look like after the COVID-19? These topics are distributed across several panels in the next 2 days. There will be a final roundtable on the world after COVID-19, as well as a dining and reception plan for those physically in Hong Kong. Lastly, I would like to congratulate and thank the organizers for putting together this timely and strategically important conference. I would like to thank you for your participation and wish that you always and also enjoy the presentation, the exchanges, and the networking. Thank you so much, everyone.
Thank you very much, Professor Lai. I'll now hand over to our VPRD, Professor Guo.
Good morning. Thank you for inviting me to speak in this conference. It's quite remarkable. This probably is the first conference where I physically attend and physically speak since last 18 months. So congratulations, we actually finally made a step forward so we can have a meeting together. And my presentation today is an introductory report to the conference, the interdisciplinary COVID-19 research. I arrived at this university on January last year, and just 1 week after my arriving, and COVID-19 start, and it was locally in China, and I gradually become a worldwide pandemic. So, well, as a VP of research, obviously, there is an immediate task to organize a bit of research work to contribute, no matter how small it is, to the world efforts on combat this COVID-19 crisis. On the other hand, we have to carry out our planning of our future research. So one of the things we emphasize is interdisciplinary research. So put this two together is actually quite nice. So basically, we have a vision and have a mission to using the interdisciplinary research as our principle and as also as our strategy to plan our research. In this case, very much focus on the COVID-19. So today I will share a bit more experience with the audience. Talking about our research inspiration of this university is actually in the 3 areas. Number one, or 3 focus, wouldn't say the area. The 1 area is research, 3 focus. 1 is our excellency. As an academic, obviously, and the research excellency is everything we care, right? Individually, faculty-wise, and the university. So therefore, that's no question about that. We want to be a leader of something. And the second area we're talking about is we will have how to say the integration of ideas or convergence of ideas. A very important thing for the interdisciplinary research is put the interdisciplinary together, which is usually a very, very hard task. Easy to say, extremely hard to do. I mean, it's not just about technically, and it's also because academic style, right? So basically, people focus their own research. And, cross faculty activity will be very much enjoyable if you come to the party or drink. But if you really come to research or organize research projects, then people have the challenge to, on many things, organizational, opinion-wise, as well as so usually it's very hard to start with. So we are talking about how to build ecosystems and also infrastructure to enable that. And the third thing, which is very, very important, everything we do, everything we are pursuing, it should be really have an impact to society. So, that's the key, local, China, and also global. So this is all we care. So this is 3 things we actually focus on. On the concrete plan and the concrete strategy we did in the last years, and then we organized the 6 labs. So we have we all call 3 clusters, but that's probably is our inspiration or our ideas about how the multidisciplinary work in this university may actually focus on. But on the other hand, we still need to put things together. We need to organize a certain kind of institutional organization. So this comes to the idea of the research labs. So it's a cross-faculty research labs. Try to facilitate the multidisciplinary research, in particular large grants. And we only practice one, probably now close to 1 year, and we made the progress. We're hiring the people, and we're funding projects, And today, some projects is really come from the lab. For example, this, the rehabilitation project is certainly from lab. So we have 6 labs. I can quickly summarize. One is the Augmented Creativity Lab. It's largely focused on applying AI technologies for art and humanity research. And the second one is computational medicine. This is also very much applied, particularly big data and AI, the computational scale, to the actually drug discovery as well as the medical research. And for example, this time, these rehabilitation projects and have certain kind of involvement from this lab. The third one is actually quite interesting, maybe a bit more related to this conference, and I call it System Health. So the System Health Lab is really quite an interesting word. Where I come with these names, and our ex-president, Roland Chin, asked me, what do you mean by system health? And I tell him is that, any systems, when we talk about health, we're always talking about our human, but human is a system. Our society is a system, right? Internet is a system. And the world, the global environment is a systems. Any systems have the well-being problems, so how the system can function. So if it was system's well-being, then we're talking about system health. So this research is really trying to broaden the concept of complexity systems, which really we are, our physics department and mathematics department care a lot, and put their science connected to all the different disciplines. And interestingly, this lab is actually now is the biggest lab, has a lot of peoples. And today, this conference, if you really want to put it in the labs, sort of the envelope, I would say this is belong to System Lab and the Smart Society's efforts. So in a way, a smart society is talking about extension of the concept smart city to the whole society, not just care about the system. And then put the system health and the smart society together. We are talking about the resilience. We are talking about how to make a system can actually deal with the crisis. So COVID-19 is obviously one of the biggest crises and the mankind now is facing. So you can clearly see it's not a vaccine, it's not medicine, it's not just about it involves everything, right? The political landscape is changing, economic impact is huge, and now we never believe we can actually now. I never believe it. I usually travel once every 2 weeks at least, but now I haven't moved anywhere for 18 months. It's not just because the economy problems, not about political, it's not because of war, it's just because of very little virus. So that is the situation we're facing. And of course, the second one is the digital data economy, right? This is also a very big research field. When I come to this meeting, I just look at the newspaper. The headline today is that Bitcoin's dropped 30% because the intervention of China. So, okay, you can clearly see this is the data economy problems in a big way. This is also a very big research area, involved politics, involved, of course, economy, but also really finance and all the other important aspects of the society. The last one, but not least, is the basic technology, is the ethical and theoretical AI labs, which is a foundation technology which is underlying all these multidisciplinary efforts. So I already summarized these labs. I'm not going to repeat it. So now we come to this. This is setting you the context. Now I quickly jump into this battlefield of the COVID-19. So this is really this. I don't know what day is this day, but anyway, this is what happens now every day. In the world, we will look at these numbers. Oh, this is the May of 12. Yeah, this is a lifetime broadcast, and of I think this is done by which university? Hopkins, I think, Johns Hopkins University, to Chinese students, and made this one. So this is actually now become really the dashboard for the COVID situation. So, and this is still going on, right? It's not really close to not even the beginning of the end yet, I believe. So there also we made some progress. There's a lot of the thing we need to do. So we have done quite a lot. And since the COVID-19 started, everybody rushed into different research on the testing mechanisms, on the research on the smart mask, and now rush into the vaccine study. All this work is not really necessarily the strength of HKBU. But what we can really talking about is really on the other side of the COVID-19. So we research on the social impact. We research on the rehabilitation programs also on, and even forecasting the environment, and we also research on environmental impact and so on. So this is and not underestimate the importance of this, okay? So if you look really carefully, in the situation of the COVID-19, many disaster is not really just because we are delayed the vaccine for 2 days. It's really because of some strange, social management structure is not done very right. So look at India, right? So it's one religion festival caused the entire countries actually in deep crisis. So that is, you can think about it, what kind of research we are, what kind of situation we're facing. So don't really know. This is our first day, we believe, this COVID-19 battle is all aspects, and not just based on if we get the vaccine, everything will be sorted out. If we have a medicine, everything will be sorted out. Not working that way. So we have this conference in May last year. I remember now is 1 year. So this is a major one we call the combating COVID-19, the hindsight to basically what we learned after this, right? So actually now we're still learning. So this conference will draw a lot of attentions, and we have a lot of people attending. And this probably embark our starting point of some interesting research work. And also, we have online international symposium till September, and organized by the Faculty of Art. And we have around about 1,000 participants and attending with 30 prominent speakers worldwide, and talking about the culture impact. And everything, and the death and the survival and the crisis and the response. We try to draw the different conclusions or different lessons we learned from the strategy from different policy. With talking about the herd immunity style with the United Kingdom, talking about the tight close down of the cities in China, and all the different strategies. And we have a very interesting dialogue. But we also research on humanity issues and a different approach, to the science. Even, and that is September, we already discussed different attitudes towards vaccine. So I think this is a very far-sighted research subject. I think, unfortunately, this work is because of pandemic, we didn't have the chance to make it a really good impact. I look back from now, this research work, and I realize how important that could be. So, and I should speed up. At 10 o'clock, right? I still have some time. So the other bits is a lot of work we're carrying on here now is on the, sometimes when you really look at the situation of the pandemic, you think about it, the disaster, but the crisis, but also people have to look at the other way around. It's also a huge opportunity. So when mankind are facing certain kind of challenge, it always implies that a great opportunity for some breakthrough innovation. So one thing we are doing now in the HKBU is the distributed art. So because we cannot move, we cannot really go anywhere, right? So therefore, we have to really rely on the Zoom. Today also, we take advantage of this new technology, and how actually to realize this new technology for the future arts. I believe, really, after the pandemic, our behavior pattern will change. Right? We finally will realize I don't need to fly that much. That's what I realized. No matter pandemic or not, I guarantee I'm not going to fly that often anymore because there's no need. I realize I can do this quite nicely by stay home. So, but then something you have to realize, this is changing. For example, the art will change. So in this case, we start to research seriously using the modern technology to look at how the art will be delivered in the future. And we remember in the last year in the East, we have the first time in the whole world, we have this East play in Italy, right, done by Zoom, right? That's quite preliminary, people sing on the Zoom and able to watch it. But today, this year, and in the Chinese Spring Festival, in my home university, the Tsinghua University, around the entire Spring Festival celebration on Dome, which is fantastic. It really looked like real. And HKBU did the similar things, and we actually did our first distributed art in the park in Hong Kong, right? Brand art with science to reflect climate change. It's called the Breathing Space. Fantastic work, right? This is the work, and we even projected a singer from Denmark use holograms. So this is another thing we're actually talking about. It's another research area we're focused on. I know UK now suddenly realized that distributed orchestra, people can play in the form of orchestra and virtually deployed in a central place, but when people play at home. That's a really great work. I mean, that's thing happening, okay? So we also quite very much pioneer in these things. And also, our researcher in the computer science department, Professor Jimmy Liu, is now our new dean in the Faculty of Science, and was jumping very early on the COVID-19 time and the study on the transmission patterns. And study, and very early, I think this is last year's April and May, so based on the Wuhan data, and to actually study the reopening plan. That's a very early work, and I think this is still have a great impact for today's policy. And our computer science department actually will be very proud of this research. And in fact, today, this 安心出行 as actually I believe you use daily in Hong Kong. No matter you like it or you hate it, this is actually inspired and initiated by BU, right? This is the work. Sometimes I'm very annoying when I have to scan it. I say, bloody hell, we made this one and it caused myself so much trouble. But on the other hand, this inconvenience do have the great impact on cities' safety. And nobody noticed that. I think it's day before, last week, Tuesday, right, when the Government Innovation Bureau come to the Secretary of Innovation Bureau and shaking my hand, and I showed my name card. You look at my name card, so you guys actually made this 安心出行. I feel pretty proud of that. Finally, government noticed that HKBU actually initiatives made this. The technology is exactly from us. Okay, so this is one of probably our biggest contribution to the city. And also, my field of data science, and we also worked actually using the data science model actually to estimating the infection dynamics, particularly quantified the impact of every single policy. So, and we can really, this is the policy of Wuhan, policy of London, and we find out each policies how much impact cost in break down the infection transmission. So this is also published in top journal. And we also using online consultings and also virtual reality to treat the social anxiety. This is also quite important. Psychology-wise, I don't know you guys, when I be locked myself in the room for 2 days, I feel pretty depressed. So have somebody to talk is a great thing to have. But then, this is we all recruit about 600 participants and to actually do the treatment of this. This is a very big job. And also, as a big project, which were reported in this conference, led by the Professor Julie Baker, is the rehabilitations for discharge to COVID-19 patients. So this is actually a quite exciting and also very well thought project. And to be frankly, we are dealing with how many, at the time, I think we're talking about 1 million people, right? And now, as we are talking about 10 million, 20 million, I don't know, how many COVID-19 patients around the world, probably 30 million or something. And all these people now, and even recovered, we really don't know what kind of health damage they had. So the important thing is not really just because they are not dying, it's because how they can, is really have to focus on how they can recover and become healthy people again. So this is great research. Why we do this, and this is multidisciplinary research, bring the sport department because you have to do exercises, our Chinese medicine, because when you do the rehabilitation, the Western medicine doesn't help you that much because it's the slow recovery, it's not have something as a symptom, it's a long-term damage of health. So the Chinese medicine, but also you need to measure the efficacy of the treatment, efficacy of your exercises, and to really monitoring your the path of the recovery. For this work, we need metabolomics. Basically, we can really measure right from the urines, from your breath, and from your blood to actually understand how far you recovered. So this is actually a very interesting project, and we got the donations, and we'll carry on the project. Today, you will probably hear some interesting initial results, including the clinical protocols and also the first batch of patients. And this work, I hope, will actually finally will have a great impact to the world. Finally, we will have rehabilitations worldwide to be in our agenda. And also, there's a lot of fake news here. When you're talking about the vaccines, these people die. That people have impact, and so therefore, a lot of news is news. A lot of news is fake news. A lot of news is half fake, half true. So all the things need to be somehow judged, assessed. So therefore, our School of Communications actually working on a research public service and building this called the fact-checking service. It's a very challenging job. Really judging objectively which piece of news is true is hard, but to actually convict this news to be false and even harder, right? So therefore, it's quite an interesting research subject. I think this is not just a media science, it's not just big data. Probably political science, social science all have the role to play on this kind of research, which is quite important. One of the research spin out from this one related to COVID-19 is about the public acceptance of vaccine. I mean, this is daily challenge now. Okay, so how to actually make this work is really related to this. So I think I can conclude this is a lot of research work we have done and a lot of work we are doing. And I do believe this is only, what I'm saying here now is just tip of the iceberg. We have a lot of other works which I don't know, or I forgot, and I probably not really summarized very well. So this conference is a very big sort of reflection of how many work we have done. So, and that's all I'm going to say. So I really think we are now still in the journey on this battle, and I really pleased HKBU, our staff, our researchers, working with international collaborators, and to make such a lot of efforts and made a lot of achievement. So I wish this conference can have a good summary and have a good exchange of all these research ideas. And I hope you enjoy the work and enjoy the workshop and enjoy your dialogue and exchange, and wish the workshop a great success. Thank you.